Good morning, Jean.
Morning, Charmaine.
And what are we talking about this morning?
We're talking about cognition and
Ah,
the wonderful work that we do and why we do it.
yep.
And we also want to talk a little bit about um, what our experience has been about the work that we do post-COVID, or during COVID and post-COVID, and the kind of complications that we've been seeing because of COVID.
Mhm. So maybe good to start with just saying what cognition does. So what what the work is that we do with cognition.
Absolutely.
Ah,
Me? Okay. Yeah, so at Cognition, we are all about the brain, all about cognitive function. And we work following the protocols and the works of Dr. Dale Bredesen, who has done a lot of research, if you have a look, on the causes of dementia, in particular dementia and Alzheimer's. And yes, The End of Alzheimer's. This is an excellent book if you want to have a read of Dr. Dale Bredesen's work. He's a lovely gentleman. And really what Dale is saying is that when you look at why, instead of looking at what is happening with dementia, we look at why dementia is happening, and Alzheimer's. So we're looking at the kind of metabolic reasons why someone may start to develop memory issues. So we're looking at things like inflammation and toxicity, things like trophic factors. So trophic factors are things that nourish the body. So things like vitamin D and your hormone levels.
hmm.
And the belief is very much, and the research is showing that when the body starts to lay down amyloid, for example, amyloid is the protein in the brain that is linked directly to Alzheimer's. Instead of looking and saying, well, okay, the brain has laid down amyloid, we're saying, well, why? Why has the brain laid down amyloid? Because amyloid is used as a protective mechanism in the body. And so the work that we do is very much looking into the whole body, the whole functional state of the body, the terrain of the body, to see what could be going wrong and is everything looking as it should. And then the aim is to correct what is potentially not balanced, with the hope of stabilizing, if not reversing,
Mhm.
Alzheimer's and dementia. And we've seen both. We've seen both stabilization and reversal.
So the interesting thing we were talking about just before we started this recording was some of the things we noted that the impact of the pandemic had on our patients. And so, the pandemic is behind us, thank goodness, and we've all kind of moved on. But I think it's left a legacy of um, it has had an effect and left quite a big impact on many of our patients. And I think, we were discussing this beforehand. I think social isolation is probably a big factor, but, there are other things as well that we were discussing. So, um, social isolation, what is your thought?
Yeah, it's been interesting. Almost one of the things that we talk to our patients about when we're working with them is that importance in doing things like brain training, and making sure that the brain, that you're exercising it. That old phrase of if you don't use it, you lose it, is very true when it comes to brain function. So we're constantly saying to patients, you need to do your brain training, whether that's learning a new language, or going to musical theatre, or going to listen to something new, or doing puzzles, or doing quizzes, or conversation with people. And of course, when COVID hit, everyone was basically told to stay at home, and that possibility of group contact and group conversations and stimulation of the brain disappeared overnight.
Mm.
And we found that had an absolutely massive impact on our patients.
Yeah, there is some interesting research specifically about social contact, and social coherence and brain health. So we do know that we are social animals, and we need social contact. So there is a lot of evidence that people who are more socially isolated um, do suffer more with cognitive decline as well. But we also spoke about another thing that the pandemic did was to change our habits. And I think, have you seen this in your patient group as well?
Massively, and even to this day, we're still talking about, I'm still working with patients who still haven't got their lives back. So especially the older generation that are more hesitant to go into big groups of people still. And also, you know, we were talking about not just the case of whether they're going out and about more, but what their daily habits are in terms of eating, drinking, and exercising. And, you know, in the pandemic, we were basically, for a long period, for 2 months, 3 months, especially in Edinburgh, you weren't allowed. Initially, it was once a week. Once a day, you were allowed out for 30 minutes or 20 minutes, something ridiculous. And then it got larger and larger, but for a lot of people that fear was there, so they just didn't go out, or they went very limited journeys. And we know the impact that exercise and movement has on brain function. So that was...
And then also a lot of people, I mean, there was a lot of fear around, a lot of anxiety. So a lot of people were doing things like comfort eating. So yeah, I think that a lot of habits just changed around that time as well.
The one thing that I noticed, and that I've had a few conversations with some of my patients over the last few months with, is one of the big things that changed was people's drinking habits. And we know the effects of alcohol and the toxicity. And the difficulty is that we always think of alcohol as pleasurable, and it is pleasurable. You know, most people like the taste of a glass of wine, but ultimately it's a poison, it's a toxin. It's one of the best kind of media marketing things ever, but the body knows it's a toxin. It doesn't matter whether it tastes nice or not, the body will recognize it's a toxin. It's interesting, Charmaine and I were talking about, we both wear one of these Aura rings, and if you wear anything that measures your stress levels, what you want to do is monitor your day, and then if you're going to have some wine at night time, have your wine and monitor what happens with your Aura ring to the stress levels, because you may think you're relaxing, but your stress levels go like this.
Yeah, it's interesting. And sleep is massively affected as well.
Massively disrupted.
You're sleeping well, but actually if you track your sleep on a wearable, you can see that the quality of sleep is actually pretty poor.
Yeah. And what was happening was people, of course, were working from home. So there was that normal thing that happens where you work and then you have a transition between work and home, where you get on a bus, you get on a train, you walk home, and that's your unwinding time, and then you arrive at home. There was none of that happening. You were literally working in your office, in the house, and then you were finishing. And a lot of people used alcohol as that middle ground of relaxation, of, right, okay, the working day's finished, now I'll have a beer, now I'll have a glass of wine. And what I'm finding in practice, I don't know about you, Charmaine, is that a lot of people got into a habit of daily drinking.
Yeah, absolutely. So previously, where people would have maybe gone to meet friends at the pub, or drank socially, that social element taken away, and like you say, using it as a transition between the workday and the end of the workday. So yeah, I think a lot of habits changed around alcohol as well.
And for brain function, I mean, we already know that alcohol is a disaster for the brain. You know, it literally kills brain cells. It's pro-inflammatory, it's stressful on the body, stressful on the liver. You only know that by your liver markers increases cholesterol. It's just a disaster if you're drinking it really consistently. And I've worked with quite a few patients who've had to work very hard going from that transition of being able to drink every day because they weren't driving the next morning either, to trying to get back to a healthy lifestyle of minimal alcohol, really.
Yeah.
And all these things have had an impact on brain health.
And then I think another thing we were talking about was that although the pandemic was all about health, it actually fundamentally has changed the way people respond to health conditions, right? So whereas before people, would be more inclined to go to the GP with little twinges, now they're less likely to go because we have, it's created this feeling of not wanting to bother the GP. And then of course we're in a situation now where it's actually quite difficult to access your GP in any case. But I think a lot of preventative care has also fallen by the wayside. Would you agree with that?
Totally. It's being missed, completely being missed. We've had this period of time of a year and a half, and 2 years, 3 years of being told constantly, even now, you only go to your doctor if it's an emergency. You only go to A&E if it's an absolute emergency. And, I do routine MOTs on all my patients. I do really thorough blood testing, and the kind of things that are being missed, the kind of things from, infection to inflammatory markers to bowel disease, that's being missed because people are saying, oh, well, I don't want to bother the GP. And as you say, I can't actually get to see a GP. Yeah. I've had patients who have had to photograph what actually turned out to be a skin cancer, but the GP never actually saw it. They only saw photographs of it. And it wasn't until it was developing that they were then able to go in and see a GP. So, and not being critical about the NHS, they're under pressure as well. But things are being delayed.
Oh, yeah, exactly. I agree. And I think, especially when it comes to brain health, prevention is really important because once there is cognitive decline, you can reverse it, but it's a lot harder than preventing it from happening in the first place. So it is really important that, I think if people are concerned about brain health, that they're proactive about it rather than waiting for, things to develop. But also, that brings me to mention the brain health program.
Yep.
So we run a 6 week program whereby we introduce a lot of lifestyle factors, and we focus on the things that people can practically do to improve their brain health. And I think it's something you do for yourself that's going to have an impact in the next 20, 30 years of your life, right? So it's habits that you can begin to build now. If you're in your 40s or 50s, that will have a big impact. If you're a little older as well, it's still worth starting to change habits and build positive habits.
That's an interesting thing that Dale Bredesen was one of the things he discovered, that dementia doesn't start when you're 70 or 80. It starts when you're in your 40s and 50s.
That's right.
And you've got a 20-year head start, 20 to 30-year head start if you do something about it now. Yeah. And that's what we're all about. We do both work. We both work with patients with dementia, but we also do cognoscopy, which is basically a really thorough MOT to find out where you are right now. So if you're in your 40s and 50s, what have you got to work on for the next 20 years to make sure that doesn't happen? Which is very empowering. And when you think about it, how empowering is that?
Absolutely. Yeah. And it is actually, I think, also having a baseline at this age is really good because, we often get people coming in saying, I think my cognitive health has changed and I'm not really sure. And, it's difficult to gauge because, people are very different in how they function cognitively. So kind of knowing where your baseline is so that if anything changes, you can quickly determine what that is. But yeah, working preventatively, I think, is absolutely key rather than waiting for something to happen.
But we do it ourselves. I do an MOT on myself every year. And when I think about, people will say, oh, golly, you've got to pay for that. I run a panel on my MOT panel for my patients, measures about 80 to 90 markers that you're never going to get checked. And it's £230. And a lot of people say it was £230. I know people who will spend that on a couple of nights out or a night out. Whereas once a year I run an MOT on myself. I want to know my inflammatory markers. I
Yeah.
want to know whether there's a strep infection there. I want to know what my hormone levels are like. We measure that too.
Yeah.
And this panel does so much detail, especially things like thyroid function. It goes into such a lot of detail of systems that it's really difficult to get tested now with your GP.
Let me put it to you this way, Jean. If you were to add an additional, let's say, 5 years of working in your life, so additional 5 years on, in terms of money value, what would that be?
Yeah, exactly.
So, you know, that's often the thing people say, oh, that's a lot of money. And you say, well, actually, if you're able to continue working for another 5 years,
What would you earn?
yeah, so you know, if you're thinking in terms of investing in your health, it's probably the, you know, the biggest thing you can invest in, because if your health goes, if your cognitive function goes, you know, you can't work, or you can't, and it's not just even about working. You know, we all have different priorities, but you know, being able to, when you retire, to be able to have energy to play with your grandkids, or to travel, or to do those hobbies you want to do. So in terms of quality of life, you know, I always think of the last 10, 15 years of your life and the quality of life that you're going to have. Are you going to be active and traveling and doing all kinds of things? Or are you going to be bedridden and immobile and all these things? And, you know, of course, there are so many factors that are at play. But so many of these things that do end up affecting the quality of our lives at the end of our lives is ultimately preventable.
Yeah, absolutely. So that's your Monday morning pep talk from Jean and Charmaine.
Next week, I think we're going to be talking about early onset dementia, and we are seeing a lot of that, more of that in the clinic. You know, people coming in are diagnosed in their 50s with early onset dementia. So very interesting studies that's come out around that we're going to be discussing next week.
Fabulous. Good.
Well, enjoy the rest of your day.
Bye.
Bye.